So this is an unusual colon polyp. This 70-year-old male presented for routine screening, colonoscopy. At the time of the examination, there were two small colon polyps which were noted in the left colon, and they were both excised. So the first polyp has the typical appearance of a tubular adenoma. The second polyp is from the colon. You can see in the lower left some normal colon mucosa there, and this at first glance looks like some sort of inflammatory polyp, except what stands out here is that there seems to be a fairly prominent eosinophilic infiltrate, and there are some larger, maybe somewhat atypical cells in the background. Here you can see again the numerous eosinophils scattered amongst these larger Langerhans cells, and the arrow points to one of these cells with a very prominent groove. In the background here you can see there are numerous cells which have a similar histologic appearance. The S100 was strongly positive in these cells. So the diagnosis on this case is tubular adenoma and Langerhans cell histiocytosis. Inflammatory fibroid polyp is certainly in the differential diagnosis. These lesions are uncommon. They're often presented as a submucosal, benign-appearing polypoid mass. Microscopically, they have a granulation type appearance in the background. There are often numerous eosinophils along with plasma cells and mast cells. The spindled cells are positive for CD34, so a CD34 and a stain for Langerhans cell would be a great way to tell the difference between these two. Langerhans cell histiocytosis of the colon as an incidental finding has been described in the literature mostly as individual case reports. This reference summarizes the literature's experience and adds a few cases. So there have been 12 reported cases, wide age range, but there's definite female predominance. These are usually an incidental finding. Patients are often asymptomatic due to this Langerhans cell histiocytosis period. Endoscopically, they usually had a polypoid appearance, one had ulceration, and one had nonspecific findings. The follow-up is interesting. Most of these patients are alive with no evidence of a systemic disease. There was one patient alive with a cutaneous disease. Our patient had a workup, CT scan of the chest and abdomen with no abnormalities, and a bone marrow that was essentially normal, and is now undergoing routine follow-up. Thank you.